we're kind of the gold standard when it comes to medical procedures. Turkey, their medical standards are a lot lower than ours. There's a high probability for cross contamination. Sometimes they're doing multiple procedures in one room. There's not as much cleaning of the equipment. So you just really want to be careful. I mean, there are great clinics in Turkey, but they're going to cost the same that you're going to as doing a transplant here in the States. So
Mm.
if you do your due diligence, you find the right clinic, and there are good ones in Turkey. You're going to spend the same amount of money, but why would you travel 30 hours to get a transplant for the same cost as you could right here in Little Italy?
All right, guys, welcome to another episode of The Report. Today, I got someone who specializes in helping men restore their hair, get more confidence, become a better version of themselves, look better, feel good. I got my man, Elijah Scholer, in the studio. What's up, Elijah?
Nothing much. I appreciate you having me in here. Thank you so much.
Dude, appreciate you coming through, my man. This is a hot topic, man, because, I think, obviously health and wellness is very trendy right now, but also I'm a big believer in improving yourself physically, right? If your teeth are jacked up, go get some veneers. If your nose is all jacked up, go get a nose job if it's going to make you happier, if it's going to give you more confidence, if it's going to make you a better version of yourself. I believe in doing those things. And with that comes hair, right?
Huge. Very important.
Yeah. The hair is a big thing. It
It
affects
is.
a lot of men. I just read a stat, 85% of men below the age of 50 experience some sort of hair loss or affected by hair loss below the age of 50. What is male pattern baldness? Break that down.
So male pattern baldness it's actually male and female pattern baldness. So it's a genetic predisposition that is called androgenic alopecia. So androgenic alopecia, genetic predisposition, it is essentially the deterioration of the hair in multiple different patterns. For men, it's a Norwood scale. For women, the Ludwig scale. Obviously, it affects more men than women, which is why my business is doing well.
Yeah, absolutely. And you said it affects women too.
It does.
Because a lot of people, they think baldness and balding, they think of men, but they don't think of women.
Correct.
Yeah. And so do you see a lot of women clients come in?
We do. About 20% of our clientele is female, which is, it affects them much faster because it's more obvious. It becomes a factor in their life, and they don't procrastinate like guys do. Most guys will procrastinate when it comes to hair loss. It's just natural. It's something that we deal with. Women come in right away and take care of it. So you don't really notice it as much.
That's interesting that women go in and take care of it right away.
Right away.
Yeah.
It's their identity. That's how they identify themselves. A woman with a thinning hair, it's not like a man with thinning hair. Women, they jump on it right away. Guys are like, it happens to everybody. I might as well just take my time and we'll figure this out later.
Yeah, absolutely.
Then it costs more money.
So talk about where the male pattern baldness typically starts.
So it usually starts in the temples. So we get some what's called temporal recessions right in the front of the hairline here and starts to go back. And that would be like a Norwood 1 is what we call that. So as it starts to go back in here, usually it goes back a little bit more.
Is that what they call a willow's peak?
A widow's peak. Or the golden arches, whatever you want to call it. It slowly goes back. As it starts to go back, it'll start to connect behind the frontal forelock and it'll start to affect the crown. In some guys, it starts in the crown, and you don't notice it too much in the temples.
Got it. And at what age does this typically start for most men, or is it vary depending on a few things?
It varies. A lot of variables to that question, but realistically, I would say for most men around 25 years old. Although we do have patients that come in like 18, 19 years old, they're noticeable. It's noticeable thinning.
At 18, 19?
18, 19 years old. Not much we can do. Obviously, if they're starting to deteriorate, we can get them on some medications to help prevent that deterioration pattern. But when it comes to a transplant, there's not much we can do to help them out except prevent it from falling out, stabilize the follicle, and then we can, talk about the option of a transplant 4 or 5 years down the road.
Yeah. You mentioned some supplements, vitamins. What are some supplements that one could take if they wanted to slow that?
So the one that we like the most and the one that we give to all of our patients prior to a transplant is Nutrafol.
Okay. What is that?
I'm not even being paid to say this for sure, but we notice a considerable difference on the health of the follicle. Nutrafol is just a compound of different supplements that are the right ones to supply the follicles with the right supplements, the right nutrients we need for stabilization and growth. Most important, selenium, zinc, collagen, and biotin. Those are the 4 main ingredients. Obviously, there's some other stuff in there. Saw palmetto is a huge natural DHT blocker. more DHT we block, the more the follicles can absorb the nutrients.
And is this more preventative or it can actually reverse the growth?
So with a stronger pharmaceutical grade DHT blocker, we can reverse the growth. We can start to regrow because we are preventing DHT from destabilizing the follicle, essentially choking it out from absorbing nutrients. So if we can get the right amount of DHT blocker in our system, then we can actually take that Nutrafol, start to re-supplement, regrow the hair by giving it the right nutrients and supplements.
Yeah, absolutely. That's interesting.
Only like 20 or 30% though. So it's not gonna be the end all be all, unfortunately.
Yeah, absolutely. And so I'm curious, why is it that the hair for a male on the sides and then the back of the head is a lot thicker and it doesn't really fall out versus the top is the first that typically thins?
So it's like an evolutionary anomaly. There's no real definitive answer to it. They say that it could be, overactive androgen receptors. There's a couple of different options that it could potentially be, but for the most part, it is just a genetic or not genetic predisposition. It's an evolutionary anomaly. Sorry, but the dihydrotestosterone is only affected by these, and these hairs are DHT resistant, so they stick around, but nobody really knows why.
Interesting. And you mentioned before we started recording, there's a new peptide coming out, PP405. Break down PP405. What the heck is that?
So PP405 is a new peptide that's coming out. It is still in phase 2 human trials. It was created by UCLA. There's a ton of money being invested in it. They say it's the next evolutionary discovery for preventing hair loss. So it's not going to be the end all be all. It is supposed to have a 5% higher efficacy than finasteride, which is the gold standard for hair loss. And it doesn't have any sexual dysfunction side effects, which is huge because when taking finasteride, there's about a 2% chance that you'll have some sort of sexual dysfunction from taking that medication.
Interesting. And when is this one supposed to come out?
They're saying, if all goes well, after these human trials, end of 2028, beginning of 2029.
Because when you say like 5% more effective, I'm like 5% doesn't sound like much to me.
Yeah,
It
it doesn't sound like a lot, but when it comes to 5% more hair for the rest of your life, it's a lot. So,
absolutely.
yeah.
So I know for me, myself, at some point, probably between now and the next couple years, I will go get a transplant. I got a little bit of like thinning on the crown, and then the hairline is slowly coming up a little bit. And so for me, I definitely want to go get that treated. At some point, I thought, Turkey might be a good option. For me, I know a lot of people do go to Turkey. Some people do it here in the States. What are some of the reasons one would not go to Turkey to get a hair transplant?
Well, I mean, medical standards, we're kind of the gold standard when it comes to medical procedures. Turkey, their medical standards are a lot lower than ours. There's a high probability for cross-contamination. Sometimes they're doing multiple procedures in one room. There's not as much cleaning of the equipment. There is no real way of knowing how much experience the staff has over there. No one's going to post their bad pictures of their failed transplants or scar tissue, cluster scarring from the extraction area, the donor zone. So you just really want to be careful. I mean, there are great clinics in Turkey, but they're going to cost the same that you're going to as doing a transplant here in the States. So if you do your due diligence, you find the right clinic, and there are good ones in Turkey, you're going to spend the same amount of money. But why would you travel 30 hours to get a transplant for the same cost as you could right here in Little Italy?
Yeah. I've been to Turkey twice. Gorgeous area,
Absolutely.
man. Freaking awesome beaches. I've traveled all the way through the Turkish Riviera, Antalya, Gümüşlük, Fethiye, Bodrum. Bodrum is and Yalakavik Bodrum is like one of the most trendy like areas right now in the world where all the mega yachts are pouring into. A lot of the money's going in their development. And love some good baklava and Turkish tea.
Rich in history.
But what's that?
It's rich in history.
Yeah,
Beautiful there.
There's an inside joke though, like that if you go on the Turkish Airlines flights from Turkey or Istanbul out to LA or New York, that half the plane is all men with their heads all wrapped up and bandaged.
They call it the Turkish hairlines.
The Turkish Airlines.
Hairlines. It's cheesy, but I love it.
Yeah, that's funny. So who makes a good candidate for a hair transplant and who does not make a good candidate for it?
I think a good candidate is somebody that doesn't have any underlying issues. Obviously, we want to stay away from scarring alopecia. We want to stay away from alopecia areata, like different forms of hair loss that we can't transplant into. So We got to make sure that the patient doesn't have any of those underlying issues. We want to make sure that the patient's not experiencing a lot of hair loss. We want to stabilize the follicle, and that could be anybody. Like, we obviously we're going to notice deterioration, but if it's aggressive and it's still happening, we want to try to stabilize the follicle. So the only people that I would say aren't a good candidate, people that aren't in great health, people that aren't willing to take something to help create longevity for the post-operative care, and the people that have underlying issues or other forms of alopecia that could prevent an optimal outcome.
So when you say like stabilized hair loss or very slow hair loss would work, but if it's rapid loss, it wouldn't work. Is that similar to like because I've gotten a LASIK procedure done with my eyes, and they say like you shouldn't do LASIK until your eyes stabilize.
Correct.
It's the same. It's the same idea, same
Same
concept.
idea.
Got it.
But luckily, we have a stabilization program. So anyone that comes with us to do a transplant, we put you on everything you need to stabilize the follicle. And usually it takes a month to 2 before we can actually get you in for the procedure, but we can actually stabilize the follicle for you, get you on long-term care, and make sure that the results are long-lasting.
Got it. And so break down what exactly is a hair transplant.
So a hair transplant, there's a couple different options. There's the old FUT, now it's called LSI, which is linear scar incision. And that's where they take that big strip out of the back of your head. It's barbaric. It's outdated. I don't recommend doing it.
They just cut the strip out of
They just
the back
literally
of your
cut a strip of scalp out, depending on how many follicles you need. They pull your scalp back together, staple it, and yeah, it's gnarly for
What year
sure.
did they come out with that one?
Oh, shoot. It's been a long time. I couldn't tell you the exact date on it, but it's probably about 30 years ago.
Damn. Okay.
Yeah. And then 20 years ago, they came out with something called FUE, follicular unit extraction or follicular unit excision. And that one is where, back in the day, it was where the term plugs came from, because they were taking out actual plugs of scalp and relocating them, and it looked ridiculous, but that's how we all evolved. We had to get to where we're at now, but somehow. Now we take an extraction tool. It's usually about 0.8 to 0.9 millimeters. And we take 1 in every 6 to 1 in every 10 follicles from just the occipital area, the donor area of the scalp. We remove that and we put it where you need it. So
Is that coming around the sides at all?
usually we'll go up to about the front of the ear.
Got it.
We want to stay in the area that's DHT resistant because we don't want to transplant the hair that's going to eventually fall out. We want it to be permanent.
I see what you're saying. And so when you say 1 out of 6 to 1 out of 10, it's not noticeable to the naked eye.
Correct.
Got it.
Yeah.
Okay. And then once you take those out, how do you guys put them into the new area?
So we do it a different way than some places. There's some new gimmicky, they say it's more advanced because it's that DHI, the direct hair implantation, where essentially they're removing and they're just plopping them in place all at the same time. We go through and we create the sites, the recipient area first. That way we know exactly how many follicles we need to extract. And that way we're not over harvesting, we're not creating any issues, and we're not going to create necrosis by implanting them too close together. So we get a perfect layout with consistency based on where your deterioration is.
And how do you know, like, do you guys draw them on, or how do you know exactly where they should go?
So it's all randomized. The randomized kind of algorithm that we kind of do. If you try to stick to a pattern, you end up with almost like rows of hair. So, and I've seen it many times where people think, yeah, if you just go back and forth in this little pattern and then alternate, it looks good. But then realistically, if you look at it from the side, it's like straight rows of hair, almost like doll hair. So you want to prevent it. It's just all randomized little tiny incisions. And we just try to get as many as we can in the area without, like I said, creating some sort of clustering or inconsistencies with the hair on top of the scalp.
And I see you guys typically like when patients go in, you guys like shave their heads or do you guys go down to a 0?
We go down to a 0 on the back of the head. The donor area only definitely has to be down to a 0, but we can leave the hair on top long. So you don't actually have to cut all your hair off for the procedure. It does cost a little extra. It does take a little longer, but we can leave the hair long on top.
And that's why most guys just take it off?
Yeah, most guys just take it all off.
It's a quicker procedure that way?
It's much quicker. It's much easier. We can identify the areas that need, more density that way as well.
Yeah, and you guys measure the volume by the number of grafts, is that right?
Correct.
What's a typical procedure in terms of the number of grafts that someone might get?
So on average, I'd say around 2,500 grafts. And everyone's a little different. Everyone's at a different pattern of deterioration. But most of the time when people come to see us, since we don't charge per follicle, we want to get the whole hairline taken care of, and we want to add a little bit to the crown. Why not? We're already in the chair. Let's get it done.
So 2,500 follicles would equate to 2,500 individual hair grafts that you guys are pulling out,
Correct. Well, it's
or hair
individual.
follicles.
Yeah, follicle is what it's called in our head, and a graft is what a follicle is called once removed from the body. So a lot of places will kind of trick you. There can be 1 to 4 hairs, even up to 6 hairs per follicle or graft. So a lot of times places will tell you that you're getting these, you're getting 2,500 grafts, but they're going to say hairs because we're not going to know the difference. So you got to make sure you, like I said, do your due diligence, make sure you're talking to the right people.
Yeah, absolutely. Hey guys, if you're looking to get into real estate investing, but you're like, hey, I don't have the time, but you want to participate in the passive income, the tax benefits, and the wealth building, my company, Summers Capital, partners with limited partners, people like yourself, and we go out and buy boutique hotels. We have a fund where we currently own 5 hotels, and we currently have a wait list for investors to participate with us. If you want to learn more to see if this is a fit for you, you can go to summerscapital.com/invest to inquire and get on our wait list and be notified next time we have an opportunity. Again, summerscapital.com/invest. Now back to the show. So you mentioned 2,500 is average. What's on the low end that you might see a client take or get, and then what's the high end that you might see?
So I'm usually around, well, I would say we do some touch-ups, about 800 grafts. We do it, and that's usually someone that got a transplant 10, 15 years ago. It's thinning behind the area that they got transplanted. We'll just go in there and thicken it up a little bit, give them good consistency. Those are touch-ups. They're pretty quick. They're easy. It's a
800. That doesn't
800.
sound like much. How long would that procedure take?
Take about 4 hours.
Damn, 4 hours.
4
okay.
hours. Yeah. When you're taking them out one at a time, cleaning them up, counting them, making sure they're workable, separating for how many hairs are in the follicle so we can get an accurate count. Takes a little bit of time.
Damn,
consuming.
it's really one at a time.
It's one at a time.
And it's all by hand?
All by hand.
Damn.
Yeah. Every
So
little
how
site
long-
and everything.
So you do 2,500. How long does that take?
Usually about 8 hours.
8 hours. Okay.
We max out around 3,500. And
Per day.
3,500 in one procedure.
Got it.
Because you'll notice a cannibalization of the surrounding follicles that strong survive. So if we do too many, there's a lot of holes in your head. So if we put that many holes in your head, your body's going to repair at a certain rate. So the strong survive, the weak will kind of be cannibalized.
Yeah. And so on the high end, a client that needs a little bit larger procedure, how many follicles are we talking?
Usually we do around 3,000 to 3,500.
Got it. Oh, so you typically don't go over that.
Yeah, we don't want to do more than that because those follicles are pretty precious as we get to a certain part in our life. We only have so many that we can move around. So we want to keep our efficacy around 95% for the procedure. We don't want to lose any follicles. We don't want to waste anything. We want to make sure it's optimal results from that procedure.
Got it. And then how do you measure exactly how much you should put in? Like if you're looking at someone's hairline or maybe the crown, how are you guys determining how low of a hairline you should bring down?
Okay. So that's a great question. It really is based on what is available. So if we only have so many follicles available on the back of the head, we don't want to over harvest. We don't want to make it apparent that we're robbing Peter to pay Paul. So we don't want to bring the hairline. We don't want to Jamie Foxx everybody. We want to make sure that it's, age appropriate. And that front hairline, we try to get around 50 to 60 follicles per square centimeter because we only use single haired follicles because it's how we keep it natural looking. Behind that, we'll lower the graft count down to about 30 to 45 because there's 2 or 3 haired follicles that we utilize in that area. Behind that, we'll keep it around the same, about 30 to 40 grafts per square centimeter. That way we can use the 3, 4 hair follicles to create the same amount of density with less utilization of follicles. So it's hard to measure it all out because it's staggering back with the amount of hairs we use, or follicles and hairs we use. So it really determines, it's really based on the amount of hair that we have, how much space we have to cover. And
so is there any weight to like what the client wants?
there's tons of weight to what the client wants, but sometimes what the client wants isn't 100% realistic. And we have to have realistic expectations with the hair transplant because we don't want to upset anybody.
So break down like LeBron James, for example. Everyone knows LeBron. And you could tell he was balding, and then all of a sudden he came back one season and had a full head of hair. And that you're saying that's only 3,000 follicles, huh?
Yeah. So I mean,
That looks like a big drastic change.
drastic change. Well, if he was on medications and he was doing regular stem cells, PRP, exosome, some form of, injectable that's going to help with the revitalization of the stem cell bulge, then he's going to have some of that natural regrowth. And then a transplant, he won't have to do more than 3,000 because we're going to stabilize the follicle. We're going to regrow what we can. We're going to maintain that with the medication. So the transplanted follicles could be, 2,000 to 3,000 and still give him that full head of hair. he's just going to have a lifetime of medication to take afterwards.
Did anyone go like back-to-back procedures where like you heal and then 6 months later you do another one?
So we actually can't do a procedure 6 months later. We got to wait for about a year to do a second one. So we have had people that have come in, and I wish I had pictures to show you, but they come in full cue ball, like nothing, full cul-de-sac. It's just completely deteriorated. And doing around 3,500, you're going to get great coverage, but sometimes it's not the coverage people want. They want more. You know, how
You get to go
plastic
for that
surgery works.
7,000.
Yeah, right. Plastic surgery, you get to a certain point, you're like, my nose looks great, but let's fix let's do this over here. Let's do that over here. So they come in for a second one, and after that, they have a full head of hair, and they'll never have to worry about it falling out.
Damn, that's crazy. And then I've heard of some people, if they have like thinning in their beard, you guys can do the beard follicles as well.
Yeah, we do beards, we do eyebrows for women. The women in the 90s that plucked it, the Britney Spears girls,
Yeah.
they regret that. So they come in and we make them nice and bushy, like the trend is going on right now.
Damn.
It's crazy, right?
That's crazy. Okay, so I know the recovery process is like it's typically like a 6-month thing. Break down the recovery process timeline, what all that looks like.
Okay, it's interesting because when you're doing a minimally invasive procedure, it's not as aggressive as most people think.
Okay. Actually, you know what? But back up, Elijah.
All right.
I want to know start to finish. So a new client coming in before the procedure, walk me through everything, start to finish, and then the recovery.
Okay. So I make this easier for everybody so that they don't have to hear me repeat this 4,000 times. So what we do is we actually send text message notifications for every milestone before and after. So it's just wake up, look at it, do this, don't do this. So we've kind of worked that issue out of the equation. But so beforehand, we usually put you on some sort of medication or some sort of DHT preventative, DHT blocker. And then we'll put you on a nutrient-based supplement, more than likely Nutrafol, to kind of help stabilize the follicle and get you on that program for about a month or two prior to the procedure. Once we get to about 10 days out, we're going to tell you to stay out of direct sunlight because we don't want any sunburns. We don't want any damaged skin going into the procedure. 7 days out, discontinue alcohol, discontinue nicotine, discontinue all your blood thinning supplements like omega fatty acids, the turmerics, even the Nutrafol. We have to discontinue that because we don't want thin blood. Once again, we're putting thousands of holes in your head. Thin blood's not going to make it very pretty. At day 2, we discontinue caffeine, which I think is the hardest thing for everybody. Yeah, that one is aggressive. Most people come
2
in
days from the procedure?
2 days from the procedure.
Really? Why is that?
Because people are so used to drinking coffee that we have withdrawals when we don't have the caffeine in our body. So people come in, they have caffeine withdrawals, they have headaches. That's the biggest, probably the most asked question that I get is, when can I have coffee again? That's literally the day before the procedure. It's crazy.
That's intense.
So the day of the procedure, we pick you up, we bring you in, we prepare you, cut your hair, draw the hairline on, whatever the case may be for that day.
And is that like the day of the procedure? Is that when you guys are lining up exactly the game plan, or is that something that happens prior to the procedure day?
We do it preemptively just to get an idea of what is, feasible for that procedure for that individual, and then we'll take some pictures, we'll measure everything out, get an idea of it, but the patient.
So you almost have renderings of what you'll look like.
Yeah.
Really?
Yeah, but
That's
the problem is we can't do renderings. Because if for some reason that rendering doesn't look exactly like the patient later on,
you can't say, "Hey, this is a projection."
Yeah, we can, but then I'll probably end up with a bunch of lawsuits, and that's the last thing I want.
Yeah.
So the rendering I can show you is what you're going to look like if your hair completely falls out, and that's a scary one to look at. So that's a good one to utilize. We try not to, but when they come in, they bring us pictures of their youth. They bring us pictures of hairlines they want to recreate. We recreate it, take pictures. The day of the procedure, we'll recreate that. We'll have them sign a hairline consent form saying that this is what they wanted. They're the ones that brought it in. We agreed to what it's going to look like. And then we start the procedure. Afterwards, you're going to sleep like a baby. We just say you go home, eat some food, sleep. But for the first 3 days, you're sleeping at like a 20-degree angle. So you're not sleeping flat. You got to have your head above your heart, slightly elevated.
Why is that?
We want to keep the blood pressure low on the new follicles. It's the rooted cellular adhesion, a little incision we make. The coagulation of the blood is the only thing holding that in place. So if our blood's thin, if our blood pressure goes up, that follicle is going to push out and create something called popping, which is not a good thing. So the next day when they come in for their follow-up, we have to get everything, we wet everything, and then try to push everything back into place.
Yeah.
So the first 3 nights, we have you sleep at a 20-degree angle, 20 to 45, depending on age and health. with a
Do
neck
you
pillow.
have to wear a bandage?
First night only.
First night.
First night
Okay.
only. Yeah, the second day when you come in for your post-op appointment, we'll cut the bandage off, clean you up, make sure everything healed in place well, and we walk you through the first 48 hours. First 48 hours, you're going to be spraying a wound irrigation spray, like it's something we use called Surgery Heal. They'll spray that every 90 minutes on top of their head, and they'll do a massage. Because when we cut the bandage off, it looks like a bike tire like went right over your forehead. So you're doing like a massage to help process some of the fluids, to help make sure that the swelling's not as aggressive. You do that for the first 2 days. On day 3, you'll start to take a shower, neck down only, and you'll use baby shampoo poured gently over your head. We do that from day 3 to day 14. And usually by day 14, most of the scabs have kind of fallen off, and we kind of gently massage them at that point to help help remove some of the scabs. So we don't want them to linger around.
Yeah. And how does your hair look, 2 weeks in?
It looks interesting, to be
Yeah.
honest with you.
Yeah.
There's some inflammation, there's some redness.
Yeah.
The hair is still there. It looks great. You're going to see exactly what your new head of hair is going to look like. But then around week 3 to week 4, all that hair falls out.
Okay.
And it ends up back at square one.
Why does it fall out?
So the hair follicle has a life cycle of about 2 to 6 years. And that, it has about 10 to 15 life cycles in your lifetime. So there is the catagen phase, the telogen phase, and the anagen phase of a hair follicle's life cycle. The anagen phase is the growth phase. And then when you enter the life cycle, it goes in the catagen phase. When we transplant the hair, the follicle, that follicle goes into shock, and then it immediately jumps into the catagen phase. So it appears to be growing for the first 3 to 4 weeks. And then around that time, that falls out. Usually falls out with the scabbing. Freaks a lot of people out. And then it rests in the telogen phase. And so we have no growth for the first 3 months. Usually around 3 to 5 months, we start to see all that hair start to grow through. The growth is thin and wispy. So it looks great. Everyone's happy with it, but they're like, why does it look so weird? It's not the hair that I anticipated. Your hair doesn't pop out super thick. It has to go through that growing phase. It's thin. It starts to add diameter over time.
Got it. And so, how many months is it before you're like, all right, this is the finished product. This is 100% what it's going to look like?
So it's always growing. Usually by about a year, people are very happy with the diameter of the follicles, the spacing, the density, how we recreated it. But even for me, I'm 18 months in for my transplant. Before it was,
you did yours 18 months ago?
I did mine about a year and a half ago. So my hair
looks good, man.
Thank you. Appreciate
and
it.
How many follicles did you do?
I did 1,800.
1,800. Okay.
Yeah, I brought my forehead from 9.5 centimeters down to 7.5 centimeters, and my temples were about 12.5 centimeters, and now I'm about 9.5 centimeters.
Got it. Okay.
So good age appropriate curvature,
Yeah.
but I'm not, I don't have that golden arch anymore.
And why did you decide to go you said 1,800?
Yep.
Why did you go with 1,800 versus doing like 2,500?
So for me, 1,800 was all I needed. One, I didn't want to over harvest. I don't want to deplete the donor area in case I have to do another one later on down the road. And I just wanted the right amount of density in the front, which was about 1,400. And then I use another 800. Yeah, my math's correct.
Yeah.
Another 400, sorry, behind the depleted area to mix in with the native hair that was still there. So I have an insurance policy. I don't want the hair to fall out behind the transplanted hair and then leave me with a weird bald strip behind my hair.
And you had some thinness in the crown?
No thinness in the crown.
Got it.
I take finasteride, 1 milligram a day, and 3 Nutrafol, and
Got it. So you strictly just did the forehead.
Just the forehead, hairline only.
Got it. That's cool, man.
Yeah.
And so you just went the whole process, and so about a year in is when you started to really notice it was full effect.
Yeah, 9 months.
Did you wear a hat for the recovery?
You can after 7 days.
After 7
days, brand new.
Did you personally wear a hat?
I did at first because it was a little. I kind of want to scare any children when I was walking around, you know. So I wore one, just a little trucker's hat, just something for coverage. Plus, you want to block out any sun. UV rays are pretty toxic for the new follicles. So I used it when I left the house. But if I was in somewhere, obviously we don't want the hat on. Less time with the hat is better. So once I was inside or once I was more comfortable, I would just take the hat off.
Yeah, I gotcha, dude. I gotcha. So who would not make a good candidate for this procedure?
People that are too deteriorated, someone that obviously has too much hair loss, where I'm not going to make a significant impact on what they look like. I'm not going to take somebody's money unless I know it's going to be an optimal outcome. So I want to make sure that, if you're completely bald and you have thin donor area, we could try, but realistically, I'm not going to, for lack of a better term, half-ass it. I don't want to do half the head. I want to make sure that we get everything covered for you.
Yeah, that makes
That's
sense.
that's the biggest one. Health issues obviously is another one, and then age. If you're too young, we're not going to do it. We're going to stabilize, and we'll wait a little while. If you're too old, not much we
Yeah,
can do for you.
I always thought like a place like Turkey would be cool in the sense that you get a little bit more privacy, right? You go back to your hotel, you're not going to run into people out there in Turkey. Talk about that. Like, is that a big deal? Because like I always thought, man, if I got it here in San Diego, like I run into a lot of people I know. People are always saying what's up on the streets. Is that a big deal? And I would probably document my whole procedure. In the recovery, I'd probably document on social media, so I guess it wouldn't be that big of a deal.
Are
But
we setting
it
something
would
up
be
right now? Is
weird.
that what's happening? Just kidding.
What's
I
that?
said, are we setting something up right now? Is that what's happening?
I think at some point in the next 3 years, I will definitely do it. But one thing, I will probably document my recovery, like and like just all the the whole process on social media. I think that'd be pretty cool. But it would be weird because I live in a high rise downtown. It would be weird like getting an elevator and like running into my neighbors. I'm all wrapped up like a mummy.
Yeah, right. Yeah. Well, it is something that a lot of people fear. Obviously, like we don't walk around and be like, yeah, I just got a hair transplant yesterday. It's not something that first topic of conversation unless you're me and I'm obviously promoting the business. But the first day you're pretty loopy. You don't even care. You go home, you go to bed. The next morning is when you wake up and you're like, shoot, how am I going to get out of my building with incognito? So the first day usually ends up, a lot of people are weird because you're wearing the bandage. Once we got the bandage off, clean you up, you sneak back in the building.
Once I can put the hat back on, I'm
Yeah,
good.
that's it.
No one would ever know.
And the first 72 hours, we want you doing nothing. We want your body to recover. So obviously, if you can take 72 hours and just chill in the house, relax, do nothing, it's going to be great for recovery. It's going to help you through the process. And obviously, you don't have to worry about seeing anybody in the elevator on the way down to wherever you're going. Maybe Uber Eats, you might have to scare some people on the way to pick up your food. But
I know,
you'll
right?
be fine.
Yeah, no, totally. And that hair that you guys use for the transplant, that's hair that's not going to fall out, right?
Right. I mean, I can't say it'll never fall out because once again, you only have so many life cycles in every one of your hairs.
But a lot less likely to fall out than the normal hair that's up top.
Correct. Yeah, it's not going to be affected by DHT. So the DHT is not going to make it thin and fall out. So that hair will be there forever. That's why that insurance policy that I talked about earlier, that's why it's so important to have that. Otherwise, the rest of the hair might deteriorate and then you will just have that one weird strip where the hairline is, but everything else could go away.
Interesting. And dude, you're partners with Dr. Adam Rohrer, founder
Alex, Alex Rohrer.
Alex Rohrer, who's founder of SD Botox, on the podcast a couple times. How did you guys partner up? That's random.
He has been a friend of mine for like almost 15 years now. I knew him since before the SD Botox days. We kind of met when I was working downtown in hospitality. Became good friends. We kind of hit it off, and as he's grown and became harder to get a hold of because he's so busy, we stayed in touch. And when I told him about starting this up and branching out from where I originally opened the clinic, a different clinic, he was like, "This is great. This works so well with the aesthetics world I'm living in." And he's a great business partner to have. He's very knowledgeable, and he's done it obviously successfully many times.
Yeah, I want to start coming in. He was on a show not too long ago, but I'm in a season right now where I'm going sober for a little bit. I'll do like
Good for you.
65, 75 days, sometimes 100 days.
Perfect time to do a hair transplant
and just really work on myself. I'll work on my body, all that sort of thing. But he mentioned that I don't know which location it is. I don't know if it's your Little Italy location or not, but he mentioned at one of the locations you guys have a you can measure your body fat. It's like a body composition test.
Correct.
Which location is that? Is that you guys?
That's not us. That's actually Hormones and Wellness. That one's located off Washington Street.
Got it.
Yeah. Great. I'm a member there as well. It's a perfect place to figure out like how your body's running efficiently, how your thyroid's running, how your hormones are going. You can check body fat, muscle mass, the whole 9 yards. It's been great.
Yeah, dude. I'm a big fan of like all those things that, are going to obviously make you a better version of yourself. If it's going to give you more confidence, I'm a big fan. Like, hey, go do it. Like I said, if your teeth are messed up, go get your teeth fixed. If you don't have good eyesight, go get some LASIK. I'm a big fan of that. And same thing with the hair. So Elijah, I appreciate you coming on, dude, dropping so much game. How can the folks get in touch with you if they want to learn more about what you guys are doing, and more importantly, if they want to learn more about your services?
Well, our website is sdhairmd.com. Phone number is 619.
Putting out the digits.
I know.
Ladies, watch out.
619-701-5530. 619-701-5530. In case you guys didn't hear that.
And what's your guys' Instagram?
Instagram is sdhairmd.com. Consultations are free. We love to help however we can.
I love it. There it is. He's Elijah Scholer. I'm Rich Summers. Listeners, thanks for tuning in. We'll see you guys on the next one. Peace.